October 9th, which means it's time for our monthly segment, KEZI 9 News Checks In. This is a monthly reminder on the 9th of the month for women to do a self-breast exam to check for any lumps or changes. KEZI 9 News anchor Renee McCullough is here with more on how you can make sure you get more of your annual mammogram as well.
Well, today we're talking to Dr. Jennifer Freeman from Women's Care, and since this is Breast Cancer Awareness Month, we want to start with what breast cancer is.
Breast cancer is a relatively common disease that affects about 1 in 8 women. After skin cancer, breast is the most commonly diagnosed cancer in women in the U.S. And we're talking about breast cancer, we're describing a tumor that arises as a result of an uncontrolled or unrestricted growth of cells of the breast tissue, and this is a result of a mutation in our DNA.
Okay, and can you talk about some of the risk factors for breast cancer?
Well, we can divide the risk factors into factors that we can control and those which we can't. Advancing age or getting older, being female, and a strong family history of breast cancer are factors that we can't control at all.
Right. What about some of the things that you can control?
Thankfully, there are risk factors that we can control or modify, and these include obesity, alcohol consumption, and tobacco use.
So is there anything that women who have a strong family history, is there anything they can do to reduce their risk?
So those DNA mutations that I mentioned earlier can run in families, and we now have a way to screen for those. We're in an exciting time where analyzing people's DNA is easier and more accessible than it's ever been, and this can be done by a simple blood test. So if you do have a history of multiple members of your family having had breast or ovarian cancer or cancer at a young age, you could talk to your healthcare provider to see if genetic screening is right for you.
All right, and then as far as screenings for breast cancer, when should women start doing that?
Well, there's some debate about that among the major guideline groups. But generally, starting at age 40, women have the option to do breast mammograms once a year. And definitely you shouldn't wait past the age of 45 or 50.
And so why should women get a mammogram then?
Mammograms are a great way to detect breast cancer early. And we've really seen the impact of this over the last 50 years in terms of dramatically decreased numbers of deaths from breast cancer. In general, when we're talking about any cancer, early detection is the key to a good outcome. Mammograms can detect breast cancer months to even years before you might find it on your own with physical symptoms or feeling a lump. And again, the earlier the detection, the less chance there is for advanced disease and death.
Yeah, great. Okay, so how often should women do self-breast exams then?
Well, you may be getting a mammogram once a year, but it's really good practice to start doing your self-breast exams once a month. Mammograms are a great screening tool, but they're not perfect, and they can miss breast cancer. And this is especially true in the younger population.
Okay.
So I recommend my patients start in their 20s or 30s and continue monthly. And the best time to do your breast exam is right after your period ends, when your breasts are the least tender and the least lumpy.
So can you tell us what we're looking or feeling for?
So breast cancer feels like a lump or a thickening of the breast tissue. Now, normal breast tissue naturally feels somewhat lumpy-bumpy, kind of like oatmeal. So what you're looking for is something that's hard or distinctly different than the surrounding breast tissue, kind of like a rock in your oatmeal.
Okay, great. Thank you so much for joining us today. And if you have more, we have more information if you go to womenscare.com.
Also, be sure to go to our website to also sign up for the KEZI 9 Checks In. We're going to send you a reminder each month to do your monthly self-breast exam.